And we're back with another segment of On the Record with Tiffany. And I have to say again, I'm so thrilled about TAN Television, TAN TV, the African American Network. They have a local feel and a global reach. And we are proud to have a channel on TAN, On the Record with Tiffany. And also I'm at my home, where I started and where I remain, on 9:30 a.m. The Answer, the place that gave me the opportunity to bring on different ideas, different perspectives, and to really prove that we are more alike than we are different, that everybody has the right to ask a question and they deserve to have their questions answered. So, and with that, I have a special guest, Dr. Woo from Metro Health. Dr. Woo, tell us a little bit about yourself and why you're here.
Thank you. I'm grateful to be here. My name is Junda Woo. I'm medical director at the city local health department, so the San Antonio Metropolitan Health District. And I am here because you said that this would be a great way to talk to people who aren't sure or feel opposite from the way I feel, just to try to build bridges.
And I love that, because that's what we're about. We're about unifying our community, because asking a question is a good thing. There's never any, I grew up believing that no question is ignorant. You can ask any question that you want to ask. Nothing is too tiny to be addressed. So with that, let's talk about public health, because you guys have been doing in the midst of a pandemic, you've got the pandemic public health initiatives, but then you still have all of the other things that our public desperately needs.
That's right. And we started the pandemic a little earlier than most people because we had all those evacuees coming to Lackland. So when people say, we've been in it for 18 or however many months, just add a few months for how long we've been in it in San Antonio. But yes.
How was that? Like, how did that affect public health, what you all are doing when we got that influx of people at Lackland?
Well, I think it got us up to speed on COVID a little faster, and both in the health department and in the community compared to the rest of the nation. So it kind of gave us a leg up, but ultimately, it's been a challenge full of surprises for everybody. But like you said, meanwhile, other things are still happening, right? People are still getting high blood pressure and having heart attacks and cancer and diabetes. We still have to also deal with environmental hazards and, maternal infections and syphilis, are a very large rate of congenital syphilis, both nationally and locally. So yes, all of that has also been happening, and it's taken us a while to get people back to working on that. I mean, honestly, a lot of stuff didn't happen either here or even up to national levels last year, everywhere, but that includes in public health. So like the CDC's 2020 update to their sexually transmitted infection treatment guidelines, they came out last month. Yeah, it's just everybody's behind.
I want to go back to something that you said about getting you guys up to speed. I just want to make sure that my listeners realize that because I interviewed some of the leaders over at university health systems, like early on in the pandemic. And one of the reasons why we did not see astronomical numbers of deaths in San Antonio was because you all had learned quite a bit, and you were able to make some very good choices for how to deal with what was coming our way at that time. So, thank you on behalf of the constituents that we work with, because we could have seen a much worse experience than what we actually have had. If it weren't for some of the quick thinking that you all, some of the lessons that you learned at the beginning.
We're fortunate in many ways. I mean, it's not just it's the resources that we have. It helps to have UT Health. It helps to have something called the Texas Center for Infectious Diseases here. It helps to have our regional advisory council, STRAC, as it's called, that brings all the hospitals together. So,
that STRAC,
yes,
having something that brings everybody together. Whenever we hear the phrase communication is key, people say that all the time. Communication is key. In a pandemic, there is nothing more vital than communication. And literally, one of the reasons why the STRAC, what Dr. Woo just mentioned, is one of the reasons why we do have, it's a resource that we have that is head and shoulders above a lot of other places. They just don't have something like that. Could you tell our listeners a little bit about what that is?
So there are multiple regional advisory councils throughout the state, but I think the way that ours for the Southwestern region is, I attribute a lot to its leader, Eric Epley, and then he's backed by, some other people. A lot of them work at University Health to help guide him, but they've been very adaptable. So we were the first in Texas to do a lot of things related to the pandemic, and some of it had to do with STRAC providing some infrastructure, even if it wasn't something that they were literally the ones doing. Maybe they were behind the scenes providing a data collection kind of, service. So, the way our fire department went out and did testing in nursing homes, we were before the rest of the state in doing that. The way we had a regional infusion center set up to give those monoclonal antibodies, again, we were before the rest of the state in doing that. And STRAC was involved in both of those. That's just two examples. Then there are many more.
I mean, yeah, there are many more. And I just want my listeners to understand, we in San Antonio, once again, have led statewide, citywide, but in terms of modeling the concept of how to how to address multiple areas of healthcare. And the fact that we, communicating between healthcare entities, hospitals have to talk to one another in something like a pandemic. It is so essential. And San Antonio, we just did a great job of doing that. And when resources are scarce, surprisingly, you see people rise to the occasion. And in our community, we really saw that with not only with the individual healthcare providers, but the structure, the infrastructure that was already built in this community really served us well. It really served us well throughout this pandemic. And it's something that should be duplicated in other places. That's my personal opinion.
There are a lot of areas where San Antonio has a culture of collaboration. People come from other places and they say, oh, this is different here. And it's important because no one succeeds alone.
That's right. And, that's what, that's a part of the heart of on the record with Tiffany, is that I see this. I know that that's true within our community. And my job is to bring it to you as the viewer so you can see it, because often we hear names like STRAC, we hear UT Health, we hear Metro Health, and we have no idea what that actually means and what they're doing in the context of the fields that they're studying in and that they're working in and providing services. Our community really does go beyond just the service itself, but there's a commitment, and there's the missions of, when you look at the mission statements of the various entities, then you can see, like, thematically, people are very honed in on serving the community and doing so in a way that is embraces the individual. And when this pandemic hit, you really saw that stuff come to life. Like the importance of that, the importance of having a culture of collaboration really came to life during the pandemic. So the pandemic has not been great, but the unity that came amongst healthcare professionals has been. It really has been. And it's leadership like yours, Dr. Woo, and teams like, when you see that team, it was team 3. When I saw team 3 and just observed them and walked around and listened, because I just blend into the background. I'm not a part of their team. So they're doing their work and not paying any attention to what I'm doing. I could be any old Joe Schmo on the streets, there with them. And just to watch them interact, making sure like Lucy is no joke. She's making sure that every one of those forms lines up with the right person, and that we know that the Pfizer vaccine was given to this individual, and how many were given. This is how many vials we arrived here with. This is how many we used. We literally ran out of vaccine each time that we've been there. The last time we did a vaccine drive there was 3 weeks ago, and we vaccinated 89 people.
Fantastic.
At that time.
You talked about the collaboration among healthcare organizations, but for me, the highlight is this kind of connection with community leaders, because that's been a little absent at Metro. There are certain community leaders that we've sort of got on a repeat list, but I want to broaden that, and we've necessarily had to broaden it, and I want to hold on to all of these partnerships for afterward too. Someday it will end. Someday.
Well, I'm telling you that you've got a partner in Texas Kidney Foundation and in American Sunrise. That's our sister organization. Like, we do a lot of stuff with American Sunrise, and the reason is because we too believe in collaboration and public-private collaboration. There is no way to stop any chronic illness, any pandemic or epidemic alone. You have to do so in collaboration, and it's important to have the people involved in it. So seeking out those community leaders and people with lived experiences is really important, like identifying that community leader that everybody loves. And that may not be the the person that you think of. It's not necessarily the pastor. It might be the secretary at the church that everybody that everybody like goes to for everything, including the pastor. You know, they're all going to this one person. And it's just when you start, but in our community, the fact that the academics and the physicians and the frontline people, because there's this whole hierarchy there in the world of physicians. The fact that all of those different groups work with the community, they're open to working with the community leaders, indigenous leaders within various communities. That's something that is unique to our environment. It really is, because that was when you see us able to reach out to the vaccine hesitant, that's how we're able to do that. We've got these great medical professionals with us. We're walking in as the heart of of what's happening, and then between us, we're really able to serve the community in a wonderful way. You know, and we have resources like Texas Diabetes Institute. I mean, it's a one-stop shop. They have everything you can possibly think of, and it's right there for our community. You know, there are just so many resources in San Antonio that are, and when you walk in, you know, the Wellesley clinics, there's a group called the Wellesley.
Yes, that's out of Methodist Health Ministries.
That's
absolutely
right. And they are just amazing. They're amazing. Those nurses are protective of the community, and they love the people that they serve. Their facility is state of the art. You will not find finer. I will take my children, myself, my husband to any of their facilities. I mean, it's just there is so much that is good and right that's happening here. That what I love to do is highlight that, because there are enough people that want to say something negative. But there are so many positive things happening. But when people are doing good things, they're working. They're doing the good stuff. They're not out.
A lot of people don't know about these sources of low cost or no cost healthcare in our communities. The Wesley centers, because they're underwritten by Methodist Health Ministries, they are free. They have more paperwork than any of the other places to get in the door. But once you complete all the paperwork, it's free.
Yeah. And you're sitting there and doing it.
Right. Then there are 2 federally qualified health centers in our community. And that means that they're given money by the federal government to serve people who don't have money on a sliding scale. So that's Central Med and Communicare. And then there's El Badi, which is a free health center just certain days of the week on the north side, and lots of other things like that.
Communicare, I just talked to them about some of their programs. I mean, we really do have many resources here. And when you start talking to the people who work within those programs, because what I like to do is, this is my own little personal thing, but I go in and I go and sit in the waiting room and talk to people in waiting rooms of different places. So one of the places that I've gone to is Gonzaga Group. And I cannot say enough about Gonzaga Group, because the entire concept of Gonzaga Medical is to give the best of the best to the least of these. It's really that, their motto, como familia, like family, is true. And when you go sit in their waiting room and just kind of, I sit down, I talk to one person, then I go talk to the next person, and then, just to see like, how do you like it here?
Yeah.
What do you think about what you're experiencing? And literally, people love it.
They gave out a lot of
They like their doctors. They like the experience. They like, and you're just like, okay, can we take this and just duplicate it all over the state, all over the United States? Because everyone deserves to be treated like they're the most important person in the world. And that experience is because when we talk about healthcare inequity, it's a nice way of saying you're not treated very well.
Right. People make assumptions about you based on about your income or
about your income, your race, your whatever it is that is the impetus for that inequity occurring. That's what's happening. Well, when you go to a place like Gonzaga Medical, the polar opposite is happening. You are being treated like you are the most important person, like you're some VIP someplace, but you didn't get off of a jet. You got out of a Fiesta and walked in there, or got off the bus and walked in, and and you're treated well. And I say the same thing about Metro Health, because the teams that we worked with there treated our people like they were important. They listened to every question, sat down and took time. We had folks who, in this particular population that we're working with, sometimes they don't know how to fill out paperwork. They don't know how to, they don't read English or don't read don't read Spanish very well, whichever language they're communicating in. And so they don't know how to fill out the paperwork. And your team sat down and did the paperwork with them. If they needed help, there was somebody there to sit down and talk to them and just walk them through each step. Everything about it was positive. And I just have to say to you, thank you. Thank you for being the leader there and for being an empowered, practical, intelligent woman running things in our city. We've been visiting with Dr. Woo today from Metro Health, and it's been a pleasure having you.
Likewise. Thank you so much.
And I look forward to having you again. You come back anytime. We love having you at On the Record with Tiffany. And you've been listening to On the Record with Tiffany. If you didn't get to hear today's message, please come check us out on 10 TV. And you can find us also on our channel there, On the Record with Tiffany, but you can find us as well on 9:30 a.m. The Answer. So come check us out. Thank you again for being with us, Dr. Woo. And I'll see you again next week on the Record with Tiffany.